Hello, I'm Dr. Melita Williams, and today we'll talk about our health. African Americans and minorities are disproportionately affected by medical conditions such as hypertension, diabetes, heart disease, and autoimmune disorders such as lupus. One underlying factor in all of these chronic diseases could be the presence of vitamin D deficiency. Vitamin D is a fat-soluble vitamin that's involved in multiple functions in the body. Vitamin D helps absorb calcium, which builds bone, and also produces insulin, which is necessary for regulation of our blood sugars. Vitamin D also regulates multiple genes and decreases inflammation in the body by regulating our immune system. There is, however, a correlation with the presence or risk of certain types of cancer with the presence of low vitamin D levels. These include breast cancer, ovarian cancer, and colon cancer. While you may have an adequate level of vitamin D that's sufficient to prevent bone disorders, that level may not be adequate to prevent the presence or risk of developing other chronic illnesses that were previously mentioned. Now, vitamin D is actually produced in the skin from sunlight exposure. Individuals with darker hues of skin possess more melanin, which gives our skin pigment and protects us from ultraviolet radiation. So the very thing that makes our black beautiful and gives us various hues of brown skin may be the very thing that increases our risk of having vitamin D deficiency. Individuals that are obese also are at increased risk of having vitamin D deficiency because of the fact that the vitamin is fat soluble. Individuals over the age of 65 produce less vitamin D, and use of sunscreen also blocks those UV radiation that's necessary for production of vitamin D in the skin. While some would call COVID-19 the great equalizer in that it has affected individuals from every continent, every race, every age, and every nation, the disparities in health were amplified in the African American and minority populations because of the percentages of deaths in this group. The individuals that are at increased risk and are vulnerable for low vitamin D levels are the very individuals that had increased morbidity and mortality from COVID-19. The American Heart Association would have you to know your numbers for your risk for heart disease. Those numbers include your blood pressure, your blood sugar, your cholesterol levels, and your body mass index. I submit to you that even more important than knowing these numbers is knowing what your vitamin D levels are. A simple blood test by your primary care physician can be done to know what your levels are. Practice healthy eating habits, including a healthy fatty fish such as wild-caught salmon or tuna once a week. Get out in the sun and take a stroll. Eat fruits and vegetables. Get adequate sleep and rest, and decrease stress. All of these things can help improve your immune system. But also, ask your doctor about checking your vitamin D levels to determine if you're at increased risk for any of these chronic diseases or if you need supplementation with vitamin D3. Your immune system is your defense against multiple sicknesses and diseases, including COVID-19. Give yourself a fighting chance. Know your vitamin D levels. This is Dr. Melita Williams with the Minority Health Education Broadcast. Be healthy and stay safe.